Hello, I'm Dr. Bhawana Mishra. I'm a senior consultant in Obstetrics and Gynaecology at Aster RV Hospital, JP Nagar. Today I'm going to talk about one of the commonest complaints with which I see patients in my clinic. So it is about, excessive white discharge from the vagina. So, before we talk about excessive white discharge, let us understand that some amount of a vaginal discharge is common. It's normal to happen during, your cycle, your menstrual cycle. So there are times, say around ovulation, that is when you discharge the egg, that you feel a clear, sticky, watery discharge, which is very, very obvious. The second thing is that, soon after periods or soon before periods, also sometimes you can see more of vaginal discharge. Also at times like pregnancy or at times when you are, aroused sexually, that you feel there's more of discharge. So all this is physiological and normal. There's no need to worry about all this. And so when is it that you think that there could be trouble? If you think that there's so much of discharge that it's staining your undergarments, or if there's a lot of itching, especially around the night, you tend to itch a lot around your private part, or if there's a offensive odor or a foul smell which is coming from the discharge, then mostly it is abnormal. Now there can be times when you have not been keeping well, when you've had fever, when you've got treated with a course of antibiotics. So these are times when you can see that you are coming across with such a abnormal vaginal discharge. Now there are people who are immunosuppressed, who are diabetics, or who have been on some kind of a medicine for a long time, say steroid treatment. All they are the ones who are more prone to getting this kind of discharge. Now, before depending on the color and the type and the consistency, we can come to know as to what it is, what could be the cause behind this kind of discharge. So, if you see rather thick and curdy white kind of discharge with a lot of itching that you're having, pain after a sexual contact, then mostly it is the yeast infection to be blamed. It's the common organism called Candida which grows on this moist area, especially if you are a diabetic, and it's quite stubborn, doesn't go very easily unless you have got the proper treatment. So this is the commonest kind of presentation that we see. Other things which can be sexually transmitted, like trichomonial infection or say gonorrhea and all, can have yellowish or frothy greenish kind of discharge with a offensive smell. Often with the sexually transmitted kind of pathogens, one tends to have lower abdominal pain and cramping, painful sexual contact, very painful periods. So this is the other kinds. The commonest one is other than yeast is, of course, another thing called bacterial vaginosis. So this is another organism which causes a very clear, a watery kind of discharge with a very, very offensive smell. It's got a fishy kind of an odor. So, especially soon after a sexual contact, you feel that the smell is just too much or the discharge is too much. Most often it ends up being a bacterial vaginosis kind of infection. Now, so generally, the glands of the cervix and the vagina secrete some fluids which can take away the dead cells and the bacteria, and thus keeping that area moist and clean and healthy. So much is normal. That kind of a discharge is normal, because many a times we see that patients have been falsely alarmed about a normal physiological discharge. Now, most of this, depending on what the reason is treated with antibacterials or antifungal creams and suspensions and lotions and douche. Now, there are some things that one can do to avoid this kind of infection. The first thing is that they use a rather mild soap. So there are a lot of, many times of hygiene wash that are available now, which has a milder pH, which suits your that area, and is not very harsh on your skin. So one can preferably use that if you're having this problem of recurrent vaginal discharge, or avoid using any kind of scented, lotions or bubble bath or sprays and all that to clean that area. Any kind of chemical will not be of any advantage there. Use mildly, lukewarm water to wash that area. I've come across patients who pour very hot water, so that relieves the itching for a little time, but that ends up burning your skin and kind of weakens the whole the potential of that skin to fight any infection. So that all this can better be avoided. Make sure that you are drinking enough water, clean that area well, and do not wear synthetic undergarments. Cotton undergarments are the ones which are preferred. On days when you think that you are having excessive discharge, you can use a small lokia pad or something, a panty liner as we call it, to stay clean and to feel more fresh and healthy. And the thing is, if you be noticing this kind of a discharge which is abnormal, sometimes it can even be brownish or blood mixed. Please do not ignore such a condition. Come to your gynecologist, get yourself checked, and find a remedy for this.